Are you curious as to whether or not a solution like tooth pillow may be a good idea for your child? If so, then stay tuned to this video. Hi, I'm Dr. Jasmine Elmore, board certified pediatric dentist and airway, breathing, and myofunctional expert. For years, my DMs have been flooded by parents around the world looking for straight answers that match their family's wellness goals when it comes to dentistry and medicine. So let's get started in today's video. We're going to be talking about tooth pillow, and not specifically tooth pillow. I want you to understand that these principles are going to be for myobrace or any of the other removable appliances that are designed for optimizing myofunctional therapy. So let's begin. What is tooth pillow? Well, I am not being paid by tooth pillow, so I'm not going to do their work in promoting their appliance because we're going to be talking about core principles. Before we can understand tooth pillow, we kind of have to understand a little bit about the face, how it works, the jaws, the muscles, and all the things around it. So what we've come to know is we have our face as we know it. That encompasses our jaws and the muscles around the jaws. We take a look at our skeletal, and let's take this soma out. If you don't know what soma is, then check out my other YouTube channel, Dr. Jasmine Elmore, and learn more about the soma. Our face, the bony elements under the face, and what's missing here are muscles of the face. What we know and what has been backed by science is that the muscles of the face, which are not shown here, but the muscles of the face dictate what happens to the bony structures of the face. And the face is important because the face is right in front of our airway or breathing tube, which is here, and then our spine. And so what we've learned is that the muscles of mastication and the muscles of the face play a big role in the bony structures under that face. So when we mouth breathe, when our tongue is in the wrong position, our upper arch doesn't form this nice, beautiful, wide arch. We have a much more crowded arch. And so if you guys want to learn more about that, leave some information down in the comments. We can talk more about how over time our function, our habits of the musculature have led to smaller jaws. And so whenever I tell parents who are interested in wellness, how do we determine finding a solution? There's a couple things we need to look at because each solution is going to tackle one main element of these three pieces or is going to try to incorporate all three. But let's be realistic. Most solutions are going to really do very, very well with one of these three solutions. So the first thing is structure. The second thing is behavior. And the last element is function. How we move, how we maneuver as human beings involves these three elements: structure, function, and behavior. And so when we're looking at a solution for our jaws, let's say the jaws are small in this case, and we want to widen the jaws, then we can do that with we just knocked a tooth out, but we can do that with a solution that attacks the structure or just the jaws. But will that solution ignore the function of the muscles around the face that got the jaws there in the first place and the behaviors or the compensatory patterns that have gotten us here? So typically what you're going to find in dentistry is that structure is going to be your appliances. Doesn't matter what the appliance is. We started off this video talking about tooth pillow. It would be great if we could also get that appliance to also incorporate some type of movement in function. And function can be a variety of things. Myofunctional therapy, and this is a shortcut for functional, but myofunctional therapy being one. We have the way that our oral complex moves when we chew, when we swallow. Those are two different functions. When we breathe, a lot of people, this involves their mouth. When we speak, and also when we sleep. And so the function of these things matters, and the structure and the function and the behavior are always communicating with each other. Now let's talk a little bit more about behavior. Behavior is very complex. Behavior can be very difficult to break. If you've ever smoked, if you've ever had a gambling or drinking problem, then you understand that behavior plays a big role in this. The first element of behavior is neurology. It is very difficult to have healthy dental architecture if you have unhealthy neurology. And vice versa. And so neurology, or the mental or brain component of it, is very important. There are certain signals that are being sent back from our bodies to our brain at all times. The other thing about behavior is compensatory, and it is also something that is learned. What I mean by that from the learned component is if mom and dad sit at the table like this, with their mouth open and hunched over, that as child, my world is going to incorporate where I'm learning from those older than me and learning behaviors that can be unlearned. But if you know anything about breaking a habit, there's some difficulty in unlearning old habits and learning new habits. Also, because we're talking about learned, a lot of emotional intelligence comes into play when it talks about what and how we learn, and also just cognitive in general. There are many other elements to this, like, for example, behavior and function overlay and overlap a lot, especially when we talk about the body's biochemistry, and then structure has other components as well. But to keep this as simple as possible, anytime you're looking at a solution, I want you to ask yourself, what is that solution doing to my structure? What is that solution going to do from a functional standpoint, and how will it impact behavior? And are there other pieces to the solution that can be added in to make the solution a little bit more valuable, to make changes in these three major components? So when it comes to tooth pillow, what we need to ask ourselves is, what exactly is the tooth pillow doing? Looking at the tooth pillow, how is it impacting our structure? It's a good question to ask those who are selling tooth pillow. Again, I'm not selling tooth pillow, but my understanding of how the appliance works is that we're operating to calm the musculature down so that the muscles of the face stop fighting the face, so that the structure can be retained. Now, if we need to grow structure, if we have a smaller structure and we need to grow and expand it, the question is that appliance of choice going to grow and expand the face? Maybe, maybe not. It's going to depend on a case-by-case basis. What and how are the functional elements going to be impacted by tooth pillow, mile brace, whatever the appliance is? And then, of course, what behavior changes, what habituation, what long-term effects can we get with wear? So these are the elements we need to think about. Now, I have a couple of parent questions. I'm going to go to them now. I asked you guys on Instagram to give me your thoughts on tooth pillow and what you want to know. And again, not tooth pillow specifically. We're not picking on tooth pillow. We want to choose appliances that people are talking about. And because tooth pillow was designed by airway dentists, we use that term a lot, but because it was designed by experts, and because it's very well funded and very well marketed, because of that, it gets a lot of attention. We live in America, or I do. I don't know where you're watching from, but it's very important for a business to gain traction, to gain interest. So shout out to them for doing a great job at that. We're not knocking that at all. The point of this video is helping parents make a deciding factor of what appliance is right for me. All right, so let's get to our questions. So we have a parent here that is asking, their kid seems to have some sensory issues. And I'm gonna just I'm just gonna put set of appliance. I'm just gonna say the jaws here. Remember, the spine also, you saw from that model, impacts the jaws. The jaws are also impacted by the musculature, all of this kind of together for how the palate of the upper arch and then the mandible or the lower arch play together. So This parent says that their child has some sensory issues in the mouth, gets anxiety around mealtime. He also wants a lot of choice and autonomy, and I worry about spending so much and not being able to get him to use the device enough to have it be effective. This is a very good concern to have. How appliances work that are removable means that there's going to be a time where the child is wearing the appliance and a time where the child is not. What I see in the office all the time is something called cognitive dissonance. Cognitive dissonance. And with cognitive dissonance, what I mean is we are here and we want to be here. And sometimes there is a discrepancy between where we want to be and where we are, who we want our child to be and who they really are. Why do I mention that? Because if we purchase a tooth pillow for our child, and last time I checked, someone DM'd me and told me in their area the tooth pillow was $3,000. So if we're going to spend $3,000 on an appliance, no matter what the appliance is, I see a lot of parents who want their child to be very cooperative, very accepting of treatment, very on board, very much paying attention to therapy, very much knowing what's going on. But the child is really here. One that struggles at home to pay attention to commands, struggles to focus long-term on topics. In this case of this mom, she mentioned some sensory issues. How are those sensory issues going to play a role into something that's going into the mouth? Maybe we could test that at home. Maybe we could buy a boil and bite mouth guard from the store and try that in and see, does the kid keep it in long term or not? Is it a tooth pillow or a mouth brace? No, but it's an affordable alternative to see, does this child even want anything in the mouth? Is there a behavioral, and I don't mean behavior as bad behavior, but I mean a neurological sign to the nervous system of unsafety. The mouth, the head and neck area directly impacts how the brain perceives what's happening around it. It communicates with the nervous system. So if we have a nervous system that's overly flooded, especially when it's stuck in sympathetic, then a simple appliance may be driving up the nervous system in a way that we don't want. So these are things to think about, whether it's $3,000, $3, you don't really want to waste your money, right? You want something that's going to make a big difference. So if a kid has sensory issues, maybe it's best to have maybe what could be, I don't know where you are in your area, but what could be a $150 appointment with a therapist, with an expert that can examine the child and determine if we have some sensory issues that may need to be worked out before we pursue any therapy that makes an impact on function, structure, and behavior, but specifically structure, whether we're talking about tooth pillow or not. So something to consider. How can we dip our toe in the water for a more affordable price before we do jump to the full thing? I do see parents regret all the time spending thousands of dollars on a solution, and maybe their child is a little what we call pre-cooperative. Sorry, make some space here. Pre-cooperative. And this is a term that we use for younger children, but I'll be honest with you, as a board certified pediatric dentist and breathing expert, a lot of children struggle with breathing. And when they're in stressful environments or environments where they feel stressed, their breathing is halted or their breathing speeds up. And because of that, their cooperation drops. And so even a 16-year-old could be essentially pre-cooperative. This term, however, is really for a younger child who's in the age range where they would be minimally cooperative, just because the brain is not fully developed where they can pay attention for long periods of times or when they can really understand what's happening in the therapy around them. So great concern from that mother. Hopefully we've addressed that here. Specifically to answer her question, it's difficult to say how the 3-year-old will do. I worked with 3-year-olds who act like 16-year-olds and 16-year-olds who act like 3-year-olds from the perspective of their level of tolerance for appointments. And so there's going to be a little trial and error there. Again, I think trying to use an over-the-counter type of mouth appliance or some type of mouth guard, maybe you can buy from Amazon or something more affordable, and trial it out would be helpful. Now, the next question is, same mom said, I know earlier is better, but what's the balance with toddlers, getting them to cooperate when they're 3 years old? Should we wait until they're closer to 5 or 6? Again, it's going to depend on the child. And also, I'll say, as someone who has coached youth basketball, I used to coach young boys under 11 years old, and then I also used to coach varsity girls basketball, high school. With the younger boys, everybody responds to coaching differently. There were some young boys that would respond to my coaching differently than our head coach, Mr. Moe. So the therapist that you choose and select may be able to pull out of your child more attention, more involvement than a different coach and therapist. So there may be some trial and error there. There may be involving more parent involvement in the process of the therapy. What I mean by that is, maybe as mom, it may be helpful, or dad, it may be helpful for you to be involved in the therapy versus a turnkey kind of, okay, they're in the therapy session, I'm going to leave them to it. It may require parent to be more involved. It may require you to do some modeling so the child can see you in an appliance or see you doing therapy and see how they can mirror that. Other kids, maybe that parental involvement may not be the best thing, and maybe just one-on-one with a therapist. It's really going to be dependent on the child. I don't think it's necessarily an age thing so much as I think it's more so level of expectations at home. There are times I go to the grocery store and I see a kid about knee-high demanding a certain cereal or demanding a certain fruit from parent. And that parent interaction and the way that they respond tells me a lot about how things may go with something that's going to impact our structure, function, and behavior. When you tell your child to get down off the counter or to do something, do they respond first time it's said, or is it second time, or is it fifth time? I think that it's time for us to have a real conversation about how our children respond to us as parents and how that may impact how they respond to others who are not the parental figure but are involved in the healthcare experience. Very uncomfortable conversation for many healthcare providers to have with parents. As a basketball coach, I had those uncomfortable conversations about a child very skilled who can play in a game and a child not very skilled just yet who may be more so on the bench. A parent seeing that player as more of a role player than a bench player and having that interaction. They're not fun conversations, but they're real conversations that need to be had. So through this YouTube video, I want to encourage you to really take as honest of an assessment as you can about who your child is at this stage of his or her life. If an honest assessment is difficult, then lean on a best friend who is not afraid to speak the truth, or someone you trust who can give you feedback onto whether or not your child might be responsible enough to handle a therapy that would intervene for their jaw and airway health, or whether or not they're still in the pre-cooperative phase. And if they're in the pre-cooperative phase, maybe something like working on the function with a specialist versus something that's removable and works on the structure may be a better fit. Let's see. Parent asks how to approach this to keep it fun and not have it seem like something to be fixed and stay consistent. Consistency is the name of the game because, again, when we talk about behavior, we can change the structure, right? But if we don't change the function and we don't change the behavior, the structure will move right back to where it was from the beginning, because what dictates the structure is the function and the behavior. If you know anything about how the body develops, our brain develops, and then the structures around the brain develop. We are soft tissue driven beings. Muscle will always win in a tug of race over bone any day of the week. So it's important that anytime we change structure, we also change function. I'll use myself as an example. I had shoulder surgery at a pretty young age early on in my career at 28 years old. And less than 24 hours after my structure was changed in surgery, my doctor, who was the lead physician for the Carolina Hurricanes professional hockey team in our North Carolina state, He had me in physical therapy to rehabituate my function and behavior. Why? Because he knows that if the structure is adapted, but the function and the behavior don't change, the structure will eventually get right back to where it started. And if you're interested in a root cause answer and not a quick fix, then these three things become very, very important. And so the question is, hold on, what is the question? Okay, so the question is, how can we approach things in a way where we can make them fun? Every kid is gonna find fun to be different than the next. When I was a young kid, what I found fun is not what a lot of young kids now find fun. And so you really have to figure out what your child finds fun. But really, it's the habits. It's the way we breathe. It's the way we speak. It's the way we sleep, the way we swallow our food, the way we chew that food, how our muscles move, what our posture is like that works really, really well. It's the habits. These habits dictate what's happening with our structure and also our behavior. Definitely has a big role in what's happening with the structure. And so, do we have the means to make it a habit in the long term? Do we have the means to become consistent with it? The best example I give is all about the foundation. If we don't have a great foundation of, let's say, brushing and flossing or other hygiene habits like bathing or showering, depending on the child's age, then we may struggle in correcting these things up front. I see a lot of parents who say their child is very autonomous. Their child wants to brush and floss, and that's fantastic. Children do need to learn how to live their lives. But as parents, very detailed and expert following behind of said brushing and flossing is vital. If the child does not want the parent flossing and brushing behind them, the parent does need to make the decision, for your health, I need to intervene. But if that is difficult, then it's going to impact the habits that you form of something more complicated, because the very foundational habits are your brushing, your flossing, your bathing, your showering, eating when you're supposed to, eating what's healthy. These things are foundational. And so if we struggle with the foundation, we really need to focus on that before we upgrade to other things. And so I don't want us to become obsessed with one of the other things that I see, which is the popularity of these things, be it tooth pillow, be it airway dentistry. These are big, big words and big, big concepts that as a parent, I've seen parents feel like, I want to fit in. I want to be involved. I want to make sure that I'm not leaving my child left behind. I want to have what everybody else has. It's the same craze around the Stanley Cups and Labubu and all these things. Popularity matters. Social proof matters. What I say to that is, we just need to make sure our expectations are in line with what's happening. So if we want the popular thing and we can afford the popular thing, but we know that we struggle with habits and we struggle with some of that interaction with our child, then we have our expectation be that things are going to move more like the tortoise than they are like the hare. If we have that great interaction with the child, if we have a child that understands, maybe plays sports, understands the importance of this is a training time, this is practice, this is a game time, and can understand and maneuver through those things, then we can move like the hare. Some of these things are going to move quickly with any intervention, be it tooth pillow, mild brace, whatever it is. Many of them are very much the same, just packaged in different forms. So let's not fall into the trap of just grabbing something because it's popular. Life is life. There are adaptations that we all have in our family around how we incorporate wellness for us. There are many things that many of us want that we just can't have right now, and that is okay. Bringing those things in at the right time matters. I'll leave you with this. I tell parents this all the time, and they love when I say it. The right solution at the wrong time is still wrong. Okay? So how we schedule things, what time and place we check a box matters. And so if you don't want to be frustrated and spend money that you can't get back. Or if money's not the issue, it's just more so time and wanting things to work. We really need to take a holistic look at the child and figure out whether or not a solution is right for them. I hope you found this video helpful. Again, I'm Dr. Jasmine Elmore, board certified pediatric dentist, breathing and airway and mouthfunctional expert. And the purpose of this channel is to give you real advice, straight talk, no fluff, no sugarcoating, so that you can make the best wellness decisions for your family. If you found this video helpful, please give it a thumbs up. If you like this content, please hit the subscribe button and turn on your post notifications. And if you have ideas for future videos, drop them down in the comment section and I'll be happy to create a video just for you. Until next video, bye. Have a good one.